cavitation on the market. And as Julie was explained, the main effect of Sonic Shaper is the variation of the pressure. And I want to be very graphic with this. Every time you are doing cavitation, you are generating a bubble, and that bubble expands within the tissue. So the first implosion, the energy you release after the first implosion is going to be something like boom. But the second bubble you generate, the implosion is going to be boom. And the third bubble you generate, the implosion is going to be boom. What I'm trying to say here is every second you spend doing cavitation, you are decreasing the effectiveness of the treatment because the positive pressure we need the intercellular space. So this is very clear because if you put negative pressure, you release that positive pressure within the tissue. So the first bubble is going to be bomb, the second bomb, and the third bomb. So you are going to be the effect is going to be better. So this is why Sonic Shaper is different, and this is why we should always do combine the low ultrasound combined with the smart pulse, and this is the real difference with Sonic Shaper, and this is what I want to add.
And I will take now the toughest question in the room, and we also got this question with the lectures last year, and we didn't really go into deep. Is this device making a cavitation? And if you want to answer this question, we have to go deep into a scientific area and say what is cavitation. Cavitation is just one of the many mechanical effects that the ultrasound is producing and is making effect on biological tissue. And also, if I say we are not doing any cavitation at all, I would be, as a scientist, I would be lying. But if you look at the diagnostic ultrasound photos screen up there, you will see two words called MI. It's a mechanical index. It's an index of possibility of having the cavitation within your body. And also the diagnostic ultrasound treatment are able to produce the cavitation process within your body. And this is the kind of ultrasound that you wish that it gives absolutely no therapeutic effects within your body. So, as a scientist, I must say yes. If they ask you, is Sonic Shaper doing the cavitation process? As a scientist, I must tell you yes. It is also doing the cavitation process. But you must know also the diagnostic ultrasound is capable of doing the cavitation process within your body. And our idea was not to basically lie to the patients, lie to the customer, but give you the most honest possible answer, yes. And yes, there is some cavitation process with every ultrasound procedure that you have on the market, diagnostic and the therapeutic ones. But what we did with this device is we were able to adopt the parameters of the low frequency vacuum and combine it with the ISV in a way that is most effectively targeting your adipose tissue, targeting the membrane of the fat cell. And this is basically the way we are made. I'm sure with this device you can give your patients the best result on localized fat tissue reduction. And you want to reduce this fat tissue in the way that you are able to get them to see the results of the muscle done with Sonic Shaper. Thank you.
Thank you, Julia, for these explanations.